Hello everyone, welcome back. Here I would like to discuss about the blood and nerve supply of face. First, the blood supply. The face is richly vascular and it is supplied by facial artery, transverse facial artery and arteries that accompany the cutaneous nerves. Facial artery is the chief artery of the face and it is a branch of external carotid artery. It has two parts. First is cervical, which runs downwards in the neck, and other is facial, which runs on the face. Now course. It enters the face by winding around the base of the mandible by piercing the deep cervical fascia at the antero-inferior angle of the masseter muscle. So in the diagram we can see this is the antero-inferior angle of the masseter. At this point, the facial artery pierces the deep fascia of the neck and enters into the face. First, it turns upwards and forwards to a point 1.25 cm lateral to the angle of mouth. Then again, it ascends upwards by the side of the nose up to the medial angle of the eye, where it terminates by anastomosing with the dorsal nasal branch of the ophthalmic artery. So, at the medial angle of the eye, the facial artery is terminating by anastomosing with the dorsal nasal branch of the ophthalmic artery, which is further a branch of internal carotid artery. The facial artery is very tortuous. This is the specific feature of this facial artery. This tortuosity of the facial artery prevents its wall from being unduly stretched during the movement of the mandible, lips and the cheeks. Now the branches of facial artery. In the face, it provides inferior labial artery, which supplies the lower lip. Second is superior labial artery, which supplies the upper lip and the antero-inferior part of the nasal septum. The lateral nasal branch supplies to the ala and the dorsum of the nose. Now anastomosis of the facial artery. These large anterior branches anastomose with the similar branches of the opposite side and with the submental artery. At the medial angle of the eye, the terminal branches of the facial artery anastomoses with the branches of ophthalmic artery. Now the transverse facial artery, it is a branch of superficial temporal artery. It emerges from the superficial temporal artery at the parotid gland, where it runs forwards over the masseter between the parotid duct and the zygomatic arch. In the diagram we can see the transverse facial artery running over the masseter muscle. This is accompanied by the upper buccal branch of the facial nerve. It supplies the parotid gland and its duct, the masseter and the overlying skin. Now the venous drainage of the face. The venous blood from the face is drained by two veins. First is the facial vein, other is the retromandibular vein. The facial vein forms at the medial angle of the eye by the union of supratrochlear and supraorbital veins, which forms the angular vein. In the diagram we can see the formation of angular vein at the medial angle of the eye by the two other veins that are, one is supratrochlear, other is supraorbital. This angular vein continues as the facial vein, running downwards and backwards behind the facial artery, but with a straighter course. It is not tortuous. At the antero-inferior angle of the masseter, it pierces the deep fascia and crosses superficial to the submandibular gland and joins the anterior division of retromandibular vein below the angle of mandible and forms the common facial vein, which further drains into internal jugular vein. Here we can see the formation of common facial vein. This common facial vein is draining into this internal jugular vein. Now the connections or communications of the facial vein with the cavernous sinus occur via through routes. One is through the supraorbital and superior ophthalmic vein. These are communicating the facial vein with the cavernous sinus. So this is the supraorbital and this is the superior ophthalmic vein. which are communicating the facial vein with the cavernous sinus. Now this connection with the pterygoid venous plexus through the deep facial vein which passes backwards over the buccinator. So another communication between the facial vein and the cavernous sinus is the pterygoid venous plexus. So this is the pterygoid venous plexus which is lying backward over the buccinator. Now the retromandibular vein. In the diagram we can see the retromandibular vein lying anterior to the auricle, and the formation of retromandibular vein is by fusion of two veins. One is superficial temporal, other is the maxillary vein. Now the dangerous area of the face. Infection from the face can spread in a retrograde direction and cause thrombosis of the cavernous sinus. This is especially likely to occur in the presence of infection of the upper lip and the lower part of the nose. This area is known as dangerous area of the face because the facial vein is connected to the cavernous sinus through superior ophthalmic vein, and it provides a pathway for spread of infection from face to the cavernous sinus. Now the nerve supply of the face. Each half of the face has sensory as well as motor nerve supply. The sensory nerve supply is via the trigeminal nerve, which is a fifth cranial nerve, and the motor nerve supply is by the branches of facial nerve, which is the seventh cranial nerve. So this trigeminal nerve, it is having three major branches. First is the ophthalmic nerve. The area supplied by the ophthalmic nerve is termed as ophthalmic zone over here, which includes the tip and the side of the nose, upper eyelid and the forehead. Then the maxillary nerve, it supplies to the upper lip, part of the side of the nose, lower eyelid, cheeks and small part of the temple. Then the mandibular zone. This mandibular nerve supplies the lower chin, skin overlying the mandible, part of pinna and external acoustic meatus and the temple. Now some clinical aspects related to this topic. First is the trigeminal neuralgia, which may involve one or more divisions of the trigeminal nerve. It causes attack of very severe burning and scalding pain along the distribution of the affected nerve. This pain can be relieved by injecting 90% alcohol into the affected region of the trigeminal ganglion or by sectioning the affected nerve. This sectioning is known as medullary tracheotomy. Now the motor nerve supply is by the facial nerve, which emerges through stylomastoid foramen between the styloid process and the mastoid process at the base of the skull. This facial nerve supplies all the muscles of facial expression except the masseter. Now these are the 5 terminal branches of the facial nerve which are emerging from the anterior border of the parotid gland. These are temporal nerve, which supplies the frontalis auricular muscles and the orbicularis oculi. Other is zygomatic branch, which supplies to the orbicularis oculi, which is a muscle of eyeball. Then the buccal branch, which supplies to the muscles of cheek and the upper lip. Then the mandibular branch, which supplies to the lower lip, and the cervical branch, which supplies to the platysma. So in the diagram we can see all the 5 terminal branches of the facial nerve. Now the clinical anatomy. First is the infranuclear lesion. It is also known as Bell's palsy. In this, the whole face of the same side gets paralyzed. In the infranuclear lesion, the injury is occurring at the level of brainstem. The nucleus of the facial nerve, which is lying in the brainstem, is affected in the infranuclear lesion. In this, whole face of the same side get paralyzed. The face becomes asymmetrical. It drowns up to the normal side. The affected side is motionless. It is wrinkle free and eye cannot be closed. Any attempt to smile draws the mouth to the normal side. During mastication, the food accumulates between the cheek and the teeth. This articulation of labials is impaired. Other one is the supranuclear lesion. In this, the injury is occurring in the cerebrum, the motor areas which are connecting with the face muscles. These are affected in the supranuclear lesion, and they are usually part of hemiplegia. Only lower part of the opposite side of the face is paralyzed. Upper part of the frontalis and orbicularis oculi escapes out because of the bilateral representation of this area in the cerebral cortex. Now we come to the lymphatic drainage of the face. The face has three lymphatic territories. First is the upper territory, which is draining into preauricular or parotid nodes. This area is the greater part of the forehead, lateral half of the eyelid, the conjunctiva, the lateral part of the cheek, and the parotid area. So the lymph from this area drains into preauricular group of lymph nodes. Other is the middle territory, which is draining into the submandibular group of lymph nodes. The area of median part of the forehead, external nose, upper lip, lateral part of the lower lip, medial half of the eyelid, medial part of the cheek, and greater part of the lower lip. These are draining into submandibular group of lymph nodes. Then the lower territory, this area of central part of the lower lip and the chin, these are draining into submental group of lymph nodes. So these are some group of lymph nodes around the head and neck region. So this is all about the blood and the nerve supply of face along with the lymphatic drainage of the face. Thank you.